Welcome everyone. So we have MRF Her, Ricky, V-Row, FA, Brody, Textbook, Dina, Luby, Miss G, Beck T. Welcome everyone. So I am actually in Los Angeles at the moment, and I have a special guest for today's live stream, which the topic is going to be ADHD, attention deficit hyperactivity disorder. And I apologize that the audio isn't the best. The plan was to be inside the hotel room, but we ran out of spots. We had to check out, and here we are in the hotel lobby. So it is a little noisy, and I apologize for that, but that's not going to stop us from doing this live stream today with special guest psychiatrist Dr. Hizbay Ali,
Hi everybody, how you doing?
and
Nice to meet you.
he's going to be helping us with ADHD. And also, the way that we're going to do this is we're going to start out by talking about the major points of ADHD and what causes it, what are the symptoms, is it really a thing in adults, or is it kind of unrecognized and then later becomes something in adults, how it's treated, the different lifestyle modifications to treat it, as well as the medications. So he's going to help us out with all those things. And we're going to start out by talking about those things, and then the last half hour is going to be answering your questions. So in total, this is going to run for about an hour. So let's go ahead and get started with ADHD. And I think one of the first things we should start out by talking about is what causes it.
Okay, excellent question. Hi everyone, how you doing? Mike, thanks for having me on your podcast. That is a great question, right? And I think we were talking about ADD being one of the most researched topics online, and it has become more of a I guess seeped into conscious awareness probably more in the last 20, 30 years. My guess is ADD has probably been around longer than that, and Mike will talk about probably how it ties into nutrition and stuff too. But in a nutshell, right, ADD, without going into all the details, there's some excellent resources online, by the way, you can go into, including on Harvard and Cornell's websites as well, about ADD. But really, the bottom line, right, is attention, focus, impulsivity, hyperactivity. These are like the core features, right? And it's basically like an inability to sustain attention and focus, especially when you're presented with multiple, stimuli, right? You're presented with multiple scenarios, and you have to kind of shift focus, maybe back and forth, or actually keep focus on one thing, prioritize that, right, and keep the other ones kind of in the back of the mind, but not shifting back and forth. So people are unable to complete tasks, really, and this happens in multiple settings. That's actually one of the key things, right? So if a kid is struggling in school, right, and ADHD/ADD, which is basically without the hyperactivity component, and we know that boys have more of that hyperactivity than girls. Boys tend to have more of the ADD. Anyways, of course, it's always questionable as to, because they're hyper, they get probably diagnosed with that more or picked up more. But in either case, if it's just school, right, like they're having a tough time in school,
Yeah.
there could be any other things that are confounding that, right? It could be a situation at home, maybe they're acting out, or it could be learning disabilities. Maybe they're not picking up on it, so they're not able to pay attention. So definitely screening for learning disabilities and all of that stuff. Obviously, they do a vision and hearing screening, right? The pediatricians usually do that. So if everything else is fine, if there's no learning disability, although we do see that ADHD has comorbid learning disabilities, right? And so that should be addressed as well. But the main thing is it happens in multiple settings. So it's not just school. Like if a kid is at school.
But you're talking about more so the diagnosis. But in terms of the cause.
Right, so I'll get to the cause.
Okay.
I'm just saying the diagnosis to give people a general idea. Like when you make the diagnosis, it's usually not just school, it's at home too. It's multiple settings, right? It's not just at school, the kids like this. Well, maybe they're not interested. Maybe the style of teaching isn't, Yeah. That's a whole other topic of like how we should, kind of individualize for boys or kids that have that kind of issue, especially ADD.
Forcing someone to learn something that they're not interested in.
They're not interested. And we do like one size fits all kind of educational model. That's when you see these kinds of things. But either way, in either case, that's how you make the diagnosis, is that multiple settings at home, they can't focus even on the things they like doing. I was diagnosed with ADD as a kid. And one of the things I know I have it is I'm a musician, I play guitar. You can't even get me to, can't even get me to focus and finish working on a song. I'll start like 2-3 songs and never finish any of them and then go on to something else.
Right.
Not because I don't love playing guitar or writing music. I just can't stay that focused. Over the years, I've gotten better at training myself on how to make my schedule, and we'll get into that later. In terms of the causes of ADHD, that's a great question. It's multifactorial. causes. The strongest link so far that they've shown is yes, there's a genetic component, heritability.
Yeah.
So getting a good family history. A lot of times it may have not even been diagnosed. Maybe it was mild or moderate as a kid. May not have been diagnosed if your parents grew up in the 50s or 60s. But since then, it's been more like accepted that yes, ADHD is not because the kid is necessarily a bad kid who doesn't want to pay attention, right? It's an inability to do that. And back in the days, you would just get excessively punished.
Yeah.
Right. So maybe it didn't go get detected until the late
so there's
80s.
definitely a genetic component, and it's
Multifactorial.
like multifactorial. So not just genetics, but genetics plays a role. And it's not like it's a single gene that causes. Oh, I got the ADHD.
Polymorphism.
Gene.
Yeah, there's a lot of polymorphisms in the genes that, especially when it comes to attention, concentration, cognitive issues, especially mental, neural circuits, mental phenomena. You can't really pin them down almost to just one gene.
Just like with height, right? We have, you get 22 genes from your mom, 22 genes from your dad when it comes to height. And overall, the combination of those 44 genes is what's going to determine your height.
Yeah.
So that's why it is possible for two short people to have a baby that ends up being really tall. Just the odds of that are incredibly small.
Yeah, exactly. So there's definitely a genetic component. There's also a component of epigenetics, right? We were talking about that, and that's where nutrition plays a huge part, and also in utero exposure, right? In utero exposure to nicotine and other toxins, which affect the migration of the neural cells during the development of the brain, right? So if you affect that, of course, you're going to have some deficits in cognition, attention, and again, there's a host of myriad of pathologies, right? There's fetal alcohol syndrome, a bunch of pathologies where you can see its effect on brain development, and that overlaps with attention, concentration, and that overlaps with ADD. So I've seen kids with fetal alcohol syndrome. Yeah, they have ADHD and they can't focus and pay attention, but that's part of a constellation of like a more broad issue.
And I think that what's going to shock a lot of you and a lot of people in general is that the impact of sugar, especially fructose, on the developing brain. And so when the fetus at 30 weeks of gestation, that fetus actually develops taste buds at 30 weeks, which means if the mom is drinking a lot of or eating a lot of sugar, that fructose actually crosses the placenta, and babies can be born with a sugar addiction right from the get-go.
Yeah.
And that impacts the epigenetics, that, like you're saying.
Yeah.
And not only do those babies, can they actually be born with a sugar addiction, but they can also, lots of times baby food has lots of sugar added to it. And then also when kids are developing their brain, they're also, most of them are consuming too much added sugar, even cereal. Just about every cereal that you look on the shelf has added sugar to it. And not to mention cupcakes in school and candy as a reward.
Absolutely.
Here and there, okay, but when it's on a consistent basis, kids getting too much sugar, it's definitely impacting the development of the brain.
Yeah, we were talking about dopamine deprivation states, right? We're talking about this kind of phenomenon, or I would even say new. I hate to use the word fad because fad kind of makes it seem like it's going to pass. I hope it doesn't. But dopamine deprivation states is what a lot of child psychologists, psychiatrists are using on their own children, because they realize that the more you get the dopamine hits, right, the harder it is to, kind of sustain your focus and live in a kind of a state where you're not constantly being stimulated by dopamine and need novel stimuli all the time, right? So people that are constantly being stimulated to keep their attention and focus, they're almost always going to need like novel stimuli all the time. They're just used to it, conditioned to it almost, right? And if you keep repeating that dopamine hit with sugar is like the most addictive, one of the most addictive things in the world.
Right, and so when you look at the way that the parts of the brain that affect the attention, or which basically what's causing the symptoms of ADHD, it's really the prefrontal cortex and your working memory to be able to sustain that attention, right?
Exactly.
And we know that fructose actually causes oxidative stress and affects the astrocytes, which nourish the neurons in the brain, and that impairs the prefrontal cortex and the longer term memories, which end up being stored in the hippocampus. That's also affected by fructose. So, so people ask, well, does sugar cause ADHD? I think it's a big contributor, probably in addition to genetics.
Yeah, this is going to be a field where really this is the exciting part of the future, which is tying in nutrition, metabolism to the entire body. And also, we were talking about mind, body, brain, gut connection. It's a really underappreciated aspect is the microbiome in our gut, and I know you talk about this a lot in your nutrition.
Yeah.
That is directly, it's one of the biggest nervous systems, right? is in the gut, and it is connected with the brain, and it does modulate neurotransmitter production like dopamine and things like that. So if you don't take care of your gut, the microbiome, right, and you talk about this with like fiber as its main source, then you're going to cause it. You're going to cause an imbalance, and you're going to cause a problem. And so the mind gut connection is real. It's very real, and that's what all the latest research is actually pointing towards.
Yeah,
that is super important.
And also too, so when your neurons are developing, and this continues throughout your adult life, there's something called BDNF, right? Brain-derived neurotrophic factor.
Right.
And this BDNF is important for your neurons to make synapses and form new branches, new connections with other neurons.
Yeah.
And things that have been shown to improve that BDNF are things like exercise, and then things that impair that are things like fructose, so too much sugar, and everything all ties together. The brain and what you're doing with your nutrition and exercise, it all ties together.
Yeah.
In terms of, we'll get into the treatment, lifestyle modifications to improve ADHD in a little bit, but everything is related, and it's so in terms of what causes it, it's likely multifactorial: genetics, what you're eating, what you're not eating, other toxins potentially, nicotine. So
yeah, absolutely. And then also like behavioral, right? Like depending on how their childhood is like, what kind of structure, what kind of that had. I'm not saying it's going to necessarily cause it, but it could definitely exacerbate it, right? There's a lot of things that you can kind of mitigate by behavioral changes or environmental changes. Sleep hygiene, right? We're talking sleep hygiene is a big one. Right? Kids aren't sleeping. Kids are on their tablets. They're up all night watching YouTube videos.
Right.
Their sleep is poor. Your brain has to get rid of toxins at night, has to consolidate memories. That's how you think clearer in the morning when a good night's sleep. Kids that aren't getting that, of course, in the morning at school, they're going to be irritable, not able to focus, not able to concentrate. So a lot of times that could be it. That could be like maybe that's what it is. And we'll get into more of the lifestyle modifications that are, I think, really important because everyone just wants to jump to the drugs.
Yeah. Now, can we dive more into the actual diagnosis? Not just kids, but also hyperactivity versus ADHD without the hyperactivity,
right?
And then adults, because now a lot of people are saying, "Well, I have ADHD," and there's actually a Ritalin or a Adderall shortage, right? And then I think Vyvanse is probably on the brink of becoming a shortage.
Vyvanse is really expensive, right? Like it's not really covered, by most insurances. So that shortage will come when that happens, I'm sure. But yes, so that's a great, excellent question.
So what is how do you actually diagnose it? And you see a lot of these telemedicine companies that are so quick to within 15 minutes diagnosing someone as having ADHD, and a couple days later they're getting their Adderall. And so let's talk about what actually makes a diagnosis. How do you make a diagnosis of ADHD?
Okay, excellent question. It's a clinical diagnosis. That's really what it is.
And can it be done in 15 minutes?
I would say no.
Okay. So how do you make that diagnosis?
I would say no. Just like everything in psychiatry, it's an extensive history taking, family history. It's almost rare that you find out, what truly that the person truly has within 15, 20 minutes. It actually takes quite a long time to make an accurate psychiatric diagnosis, in some cases years, right? Because you got the timeline of the illness play out. With ADHD, you kind of go back in a lot of ways. You do retrospective history taking of like, how were you growing up as a kid? Like I said, multiple settings, issues with attention, focus. You get that history, maybe family history also, like you talk to multiple people, the teachers, other family members, like you see the kid in your office. I've seen kids with ADHD that's bad, and it's like almost obvious. Of course, you got to rule out all the other things, like I said, learning disability, any other cognitive issues that could be impairing it, depression, anxiety, again, bad environment at home, abuse and trauma. Right? A lot of times kids aren't able to focus. We might say they have ADD or depression, but it's dealing with abuse and trauma. So it's very complicated, and you could have a few of these things happening at the same time, right? So it's not just that. So it does take, I would say, a few sessions at least to see the person over time. And when you do that, when you say, okay, this person might have ADD because we did all the history taking, he's 6, 7, 8-year-old kid, it kind of fits in. The child, him or herself, obviously, there's not that much concern of they're malingering or they're trying to get a stimulant, right?
Yeah.
It's not a little concern on that. So that's a little bit more honest. You can see the child, you can talk to the parents, and get a history taking. And then you can implement like, hey, let's try these lifestyle changes before we just jump to anything. Obviously, nutrition, diet, sleep hygiene, all of those things first. Now,
And it seems like if someone does everything right, I see a comment from Dina that's saying, I think Mediterranean countries like Greece have less ADHD. And I wouldn't be surprised by that, because typically when someone, if you look at the blue zones of the country, for example, Greece is one of them, and their lifestyle and how, they eat and how they exercise. Typically we're looking at breastfeeding for a sustained period of time, where they're getting all the nutrients and the brain development, and interacting, the social interactions with others.
Right.
All these lifestyle things. When you do all these things right, the chances of ADHD seem to be less prevalent.
Yeah, so that's a really interesting question. I don't know if there's a lot of research done specifically on that, right? Like on the diet and ADD, comparing different cultures and different diets. But that's definitely an area to be explored, absolutely. And I'm sure nutritional psychiatry is the new field, so I'm sure it's going to be explored, and they've already established associations. I don't know about causation yet. That would be a little bit tougher. More research, I'd have to look into it. But I wouldn't be surprised, right? I wouldn't be surprised. The other thing, too, that caveat is the diagnosis, is also a lot of times driven by the pharmaceutical industries, right? That's what happened with the online. All of a sudden, because of COVID, online became acceptable as a way of evaluating and diagnosing.
Right.
And all of a sudden, you saw a spike now in diagnosis of ADHD.
So one of the questions is, can you give us 3 to 5 key signs in adults and children of ADHD?
Yeah. Okay. Again, ADHD could be ADD, just ADD without the hyperactivity, or it could be with the hyperactivity. So that's one sign, right? So the hyperactivity is kind of part of it. What I would say is, basically an inability to sustain your attention and concentration to complete a task, right? Inability to do that consistently for an appropriate amount of time. Like, hey, you have a half hour, 45 minutes to finish this homework assignment. Person with ADD will not be able to, that seriously has ADD, I would say moderate at least, won't be able to sustain their attention and focus to complete that task. They'll be easily distracted, right? So something else.
So like daydreaming.
One of the core things to remember is there's I'm sure you guys have heard of radio stations, and you get a signal and you have background noise, right? The ability to detect the actual signal that you need to pay attention to, versus the background noise. That is the problem with ADD. ADD, the background noise is so hard. The inability of your prefrontal cortex to sift through that background noise and pick, hey, this is actually the stimuli that matters, right, is challenged. That's harder in people with ADHD. So they get easily distracted by the background noise. I'm trying to focus on this. Like, let's say me, I'm a musician trying to work on a song. I hear someone say something, or something happens, someone's watching, TV, I'm like, oh, distracted. Or I'm writing something like, oh, I can see myself playing guitar like Jimi Hendrix. Oh, now I'm daydreaming about me being like Jimi Hendrix.
Or you get a notification on your phone.
Yeah.
Or a like on Facebook or TikTok, or whatever pops up.
So that makes it worse, right? We're going to get to the whole social media and distractibility.
But then also things like losing keys or losing sunglasses.
Yep. So losing keys, losing sunglasses because you're not paying attention. Commonly, people with ADD, especially kids, they get punished. They almost get accused of being callous, like they don't care enough. It's not that they don't care. They suffer when these things happen, like they forgot to get flowers for someone, or remember a birthday. It's not that they're callous and are ignoring the person. It really is an inability to sustain your focus and attention to be able to complete tasks or multiple tasks. Like I was telling Mike, if I told him to go to the grocery store and get organic milk, make sure get some milk, whole milk, and make sure it's organic. So there's a couple things I'm asking him to remember. By the time he goes to the grocery store, he may only remember milk. He may not even remember the whole milk part. He might get low fat and not organic. So he might only remember one of the 3 things, really, right, that I'm kind of asking him to remember. And that's because he's not able to sustain his attention on all those 3 things. He really only remembered one, right? So that's classic ADD, misplacing things, forgetting things, easily distractible, also bugging other people. They need that stimulation. So kids in the class will be touching and grabbing other kids and bothering them. Again, not because they're trying to be mean or anything, they need that stimulation, right? So that's probably the hallmark feature. Impulsivity, they're not like the inability to think through the consequences, so they'll blurt out things. Kids will blurt out answers, blurt out, teacher will say, no, Jimmy, I didn't ask you, or, Sarah, I didn't ask you to say, not yet. So they'll blurt things out, they'll say things like that, and adults will do that too. What happens with time, and this brings us to the next point of adult ADD, right? When ADD is diagnosed as adults, because we see that a lot, adult onset ADD, that's a really controversial topic. right? It's a really controversial topic on whether is it residual ADD. So maybe the person had ADD,
Yeah.
right, as a kid.
Yeah.
About 50% of them will kind of like get better, and be able to manage their life without any medications really,
Right.
or minimal distress to their life. The other 50% will still have some distress. The hyperactivity gets better with age because as your frontal cortex develops as you get older, you're able to kind of like manage that impulsivity and learn consequences and strengthen that neural circuitry. That happens with age and wisdom and experience.
Right.
The kids these days, my concern is with social media and all, and kind of almost like a reinforcing impulsivity in a way, and reinforcing like not being distracted easily.
Well, for example, with TikTok, I mean, we have artificial intelligence with these algorithms that are designed to hack your attention, and they do a great job of keeping your eyes glued to the screen.
Yeah.
And so that's only worsening the problem, right?
It's worsening the problem, right? Again, we're talking about kids and adults that have a hard time sifting through this the stimuli, what salience as we call it. That's why I was talking about dopamine deprivation states. If you go and meditate, if you go out and into the mountains and say, hey, we're going to meditate for 2 weeks and I'm not talking to anyone, I'm not being stimulated to anyone other than my own thoughts, you'll come back a much calmer person. You'll be able to modulate your attention and focus a lot better. So that's where mindfulness and that comes into play, of course.
Right. So then we talk about the treatment with non-medication.
Yeah, non-medication.
So it really comes down to lifestyle. So what you're eating is so important, especially eating unprocessed food, avoiding the sugar, especially. Sleep is incredibly important. Exercise, incredibly important. And then, as you just talked about, meditation, and then getting outdoors, like hiking or just getting out with nature. That's where we're meant to be.
Like if a kid has hyperactivity, get them into sports, let them get tired out, use their energy. Also, they feel like they're part of a teamwork, part of a system. Gives them some structure, right? So if you give like kids some structure kind of like day, and adults too. Like I have to structure my day, and I know that I can only be productive 4 or 5 hours out of the day, right? Yeah. So I'll get my work done. The rest of it, it's a waste of time. You can put me in a 9-hour day, but I'm really only going to be productive 4 or 5 hours. Yeah. So if I do that in 4 or 5 hours, I can now go do something else and be productive in that time. So it's about structuring your day, and that's part of the thing with like the school system. Doesn't really allow for that unless they're in IEP or these kind of classes where they will tailor it to the specific disability. But otherwise, it's hard for the average person. Yeah. The one thing I want to add about the adult ADD, because I know this is a frequently asked topic, and I'm not a child psychiatrist, by the way. I'm a general adult psychiatrist. I did my fellowship in consultation liaison psychiatry. My initial plan was I didn't want to see children. I just want to do adults and do consults. Right. But I've been thrust into that role. I practice in Las Vegas, and there is a shortage of mental health psychiatrists for sure, but even nurse practitioners and other mid-levels is a shortage for children especially. So I've been kind of thrust into that role. Luckily, I have really good colleagues, that I kind of fall back on. They're child psychiatrists. But just from my clinical experience and reading, we're getting this a lot, right? We're getting a lot of adults coming in saying, well, I never was diagnosed as a kid, but I think I have ADD now.
Right.
And this started in like my late 20s, my early 30s. I can't focus. I can't, pay attention.
And it seems to be a big reason for that is people are just becoming so overwhelmed with increased work hours, the world that we live in with all this social media.
Absolutely.
We're all just being incredibly distracted. And so now it's exacerbating our brains, and it's kind of like...
And what kind of work are you doing, right? Like I do have patients that are lawyers, accountants, tax season, right? The accountant is like, I think I need a little bit more Adderall because it's tax season right now and I'm working extra hours. Yeah. So, my answer to that is, okay, I don't know how much of that's ADD versus maybe they had some mild ADD as children, but now that they're in like a very stressful environment where they have to really pay attention and focus, more than they're maybe used to, it comes across as like, I can't focus and pay attention.
Yeah.
Again, that requires a lot of like detailed, history taking of what is the scenario, what is the circumstances presently that are maybe causing this.
Right.
So, but there is some literature that says adult ADD is a thing. There is. So I'm not saying that it's not. I'm just saying it's controversial. Yeah. There is some, literature that does say that it starts later in life, but it's...
And a lot of it's so hard to sort out, right? Because someone in the comments mentioned, oh, well, the technological boom, especially, it's the technology has increased exponentially, especially over the last 20 years, where our brains really can't keep up with that.
Yeah.
But also, too, when you look at, sugar and the Industrial Revolution and the high fructose corn syrup of the 70s, and now we're consuming more added sugar than ever before.
Yeah.
That's also a huge contributing factor too. So it's probably just more than one thing that's all contributing at once.
Right. And just like with Alzheimer's, right? And they're finding like Alzheimer's, which is a neurodegenerative thing, which also affects cognition and attention and all that stuff, is also multifactorial and has a lot to do with diet, actually, right? A lot to do with diet, and especially sugar. Processed foods, added sugar. So I would find it hard to believe there's no actual causal link between that, especially since since the Industrial Revolution, where we've had baby food now has added sugar in it. Everything has added sugar in it.
Walk into your cereal aisle at the grocery store, and you'll literally everything has added sugar.
Right.
Yeah.
So and that affects cognition. They're finding that out absolutely, especially in the last 5-10 years. The literature is showing that. People used to think, oh, it just affects the body, it just affects this and that. Brain is it doesn't affect it as much. No, it does. Yeah. Absolutely, it does. When they did that study with the rats getting addicted to sugar, right? And that was like dopamine, a kind of a feedback loop with that. And sugar is the most addicting thing, I think, really. It's kind of what they show.
Yeah, so overall. A lot of that's a controversial topic, right? So some people say, well, sugar's not a true addiction. Well, it does meet the DSM-5 criteria for addiction, correct?
Yeah, technically addiction, right, is something that has negative consequences on your life. And despite knowing those consequences, you're still, making those poor decisions. Yeah, I mean, it's controversial, but I would say so. I think that sugar is very addicting, especially when you get kids addicted to sugar early on. Yeah, it's addicting. It's very hard to get them off sugar. It's like one of the hardest things possibly.
And then, so your taste buds, they regenerate every 2 weeks?
Yeah, it takes a couple weeks. Usually I tell people the first 2 weeks is the hardest, right? If I tell you stop drinking these lattes from Starbucks and all of a sudden just drink no sugar no sugar, whatever, it's gonna be really hard. But if you give it 2 weeks, it's a lot easier because your taste buds, they regenerate and you've lost that sweet tooth factor. Yeah. So I think little tips like that to help people, it does work.
Yeah.
People just need a more day-to-day, how do we kind of get around this? And I think diet and exercise, nutrition, again, exercise, you were saying, brain-derived growth factor, helping, build stronger neuron connections, new connections is a key thing.
So there is a possibility that someone can improve, whether they truly have ADHD or not, they can improve their symptoms regardless.
Yeah.
Simply by doing all these lifestyle modifications that we just talked about.
Yeah.
But if they're not able to improve that, and the severity is impacting their life where they need a medication, what are the medications that you would start?
Okay.
Obviously depends, right?
Yeah, it depends.
You have to sort out the core morbidities, make sure it's not bipolar that's contributing, or anxiety, depression. Sort all those things out, right?
Absolutely. I mean, that's a great question. Sifting through what it is that they need. Yes, there's a lot of overlap with bipolar disorder, especially someone who's hypomanic or manic. Obviously there's a lot of other symptoms that kind of go along with it, but inability to pay attention or focus. They might just be 100 miles an hour is the way their mind is racing, and they're irritable and they're impulsive. They appear that way. They may appear like they have ADD, and again, they might actually have ADD also underlying it. There's a lot of cross
overlap
in the psychopathology in some ways. So in either case, once you rule all that out, like I said, trauma, depression, people can't focus when they're depressed. People might be having acute stress from something. They could be having chronic low-grade PTSD. So a lot of things could be affecting it. Once you rule all that out, if you're like, hey, this is ADHD, or that's one of the things.
Yeah.
After the depression, okay, that's different. Again, therapy. Maybe they need medication, antidepressants. Maybe they need a mood stabilizer if they're bipolar, or whatever else they have. If it's okay, I'm targeting ADHD, then you want to think of behavioral, like you said, nutrition, behavior, sleep hygiene. Are you sleeping right?
Right. So all those things that we talked about.
All those things we talked about.
What were the medications that would you consider best for ADHD if they need it?
Yeah. Well, I think also just on nutrition, there was some literature about omega-3s. I think that also, right?
Yep.
So so after we cover all of that, after we cover hey, your diet, all of that's fine. You're at least making an effort on changing that. So medication-wise, and again, I'm not trying to push any specific medication. They're all.
Ideally, you don't want to be on a medication.
Yeah, ideally, these medications all have side effects, right? It's not completely safe. Some more than others. And usually, what we do, and I was talking to my colleagues earlier, is you want to take a look at the person, individualize it to what type of ADHD, what's the more prominent symptoms, but also what side effects these medications can have on this person,
Yeah.
boy or girl, weight issues. If someone is like overweight, of course we know stimulants will help them lose weight,
Right.
as a kind of a side effect of appetite suppression. So that may be beneficial and help their self-esteem a little bit. But again, if it's suppressing the appetite too much, that's going to affect growth,
Yeah.
right? So you have to monitor with a pediatrician. The one with the best efficacy really is the stimulants, like Adderall. Is still the one that people say works the best, and it does help. Adults, absolutely.
Yeah.
Kids, you don't want to start with that necessarily, right?
Right.
Like young children, you want to start usually with methylphenidate. I think they say that compared to everything, that's kind of the better one, or the short-acting one with children. Sometimes they say short-acting, like Ritalin, is better if you have to do that. Because it doesn't last as long, they'll get their appetite back, and also you can augment it with sometimes like alpha agonists, right? And that will, like clonidine and stuff like that, or guanfacine, that'll help with some of the impulsivity. So if that's like a specific thing, they're very impulsive, or you will just want to give them a short-acting, stimulant that wears off in the afternoon and they get home, then you can give them something like an alpha agonist. So
and of course, with that said, I know we said this 3 times already, but you want to do the things, lifestyle modifications. So if they're impulsive, you want to make sure they're not eating sugar. So because the sugar is definitely going to contribute towards that impulsivity where they're jumping off the walls. And also, that's where you mentioned sports before, exercise. You want to get it out of their system, so to speak.
Yeah.
Because they have all this energy, it needs to go somewhere.
Put them in the front of the class, right? Put them in the front of the class where they're right there in front of the teacher, right? They're literally like the stimulation is coming right there. They're not distracted.
To keep them engaged with the teacher.
Keep them engaged. They're not in the back of the class distracted by all these other kids. And, so things like that. Having maybe a structured day. Kids will respond better when you're like, hey, from this time to this time, you're going to be doing this. Less distractions, right? Minimize the distractions. Those kinds of things. A lot of kids that have like mild, like I said, and as they get older, they, will learn, through social, interaction, and they'll learn how to kind of manage their symptoms better. Again, once all of that is like, okay, we're trying that at least. How practical is it? Yeah. How practical is it to get the parents to, right? Also, buy into the model of, hey, you got to limit your children's like use of these screens and staring at the iPad, and like it's bedtime. Like you got to get them sleep hygiene again and get up in the morning, follow a schedule. It's hard to do, especially single parents, right? It's hard to do. So I understand.
Especially when what are the kids being fed at schools? It's processed food,
So that's a whole other thing, right? Processed food. Yeah. So medication-wise, like I said, the stimulants are still considered the most efficacious and the ones that work, especially in adults. But in children, like I said, the younger ones, I would stay away from like Adderall right off the bat, or Vyvanse, and I would start, something like methylphenidate. And then, as they get older, you could see, Wellbutrin is an antidepressant, right? That works, and it also has been shown to be efficacious for ADD. So if maybe later teenage years, I would use that, and also because it's really good for smoking cessation and cannabis use.
Okay.
And a lot of teenagers are doing it, which actually brings me. Let me talk about drugs too a little bit, because there's a lot of self-medication that happens. There's also just a lot of obviously, like I said, comorbid, maybe addiction, addictive personality. So that's, again, very complicated. That's why 15-minute, diagnosis, I don't buy that. You won't get an accurate one in 15 minutes from these online companies.
Right.
So with drugs, a lot of times people are self-medicating with drugs. A lot of kids and teenagers will use cannabis, right? And we say, why cannabis? Does it help focus and attention? Well, what it does is it reduces anxiety. When you can't pay attention and focus,
for most people, anyway.
For most, you can become really anxious, right? You can be really anxious. I'm just telling you what the kids say when they smoke pot. A lot of it has to do with they're self-medicating their anxiety, maybe
to treat their anxiety.
And sometimes they'll say, again, paradoxically, you might think this as adults, but they'll say they can actually focus better when they're high, when they're using cannabis. And that's, again, I'm not condoning the use of cannabis, and children shouldn't be, because it affects cognition in other ways. And we know that it reduces your IQ long term if you keep using it prior to the age of 25, 27, whatever, So, of course, not recommended. But the reason they're doing it is because they're maybe self-medicating for anxiety. A lot of anxiety coming from ADD because they're anxious at school. They're anxious around people. They're getting in trouble or not being able to focus. It kind of reduces those jitters and that anxiety and that impulsivity. So that's kind of what, if they're self-medicating with that, Wellbutrin is great. Is it going to make them stop smoking marijuana? I don't know, but it has been shown to reduce marijuana, use and smoking as well. So I would go there. I would try Wellbutrin also. And then you can always, like I said, Vyvanse and a little bit older adults, teenagers, adults. Vyvanse seems to be the best tolerated medication, and it lasts a little bit longer, so people do like it the best. It doesn't give you quite the jitters that sometimes Adderall will give you when it kicks in right away. So I think Vyvanse is the one that people are talking about. There's some newer ones out there that are longer acting too. So the longer acting that they are, adults say they find it better. Also, it reduces the chances of addiction. If you have the longer acting one, it reduces the chance. Again, depends on your metabolism. Some people are fast metabolizers. The people that are fast metabolizers, if you give them like the instant release ones, they'll metabolize that really fast.
Yeah.
That is a higher potential for addiction in that as well.
Okay.
So you kind of also all have to like weighed against what do I have here?
Yeah.
But I guess the longer acting stimulants are probably considered like the most efficacious. If after everything else, or you're trying everything else also. So
Yeah.
I don't want to make it like just do that.
Yeah, I mean, definitely the last resort would be medications. So the first step is lifestyle modifications, everything we just talked about, eating unprocessed food, cutting out the sugar, at least keeping it to a very, very minimum, getting good sleep, exercise, incredibly important, meditation can help, getting outdoors, out with nature, that's what we're meant to be doing. So definitely lifestyle modifications. Another thing, I wonder, intermittent fasting, because we know its effects on brain are incredible. It increases BDNF, and we talked about BDNF earlier, and BDNF has an important impact on the way that neuronal connections are made.
Yep.
The caveat, though, is that intermittent fasting, you probably can't do that with kids, right? Because they need to eat a lot to grow, and with with that caveat, you maybe, I don't know what age would be appropriate to start intermittent fasting. Probably 18, I don't know. But
I mean, with kids, like kids are growing, this whole thing about like fasting, is that kids don't have to, right? Kids will eat when they're hungry.
Yeah.
The main thing is to have them,
eat the healthy stuff.
Hell yeah, to only give them the options, which is hard again in a school. If they only have the options to eat healthy stuff, they can eat. Kids are running around active; they can eat all day long. Like they're growing. I think it's fine, but it just has to be real food.
Right.
It just has to be real food. No added sugar, right? We were talking about it earlier.
Yeah.
Adults really can get away with a little bit added sugar. Okay, but
no
kids,
more than so adults shouldn't be eating no more than 25 grams per day. The younger you are, the less you should be eating. Ideally, it would be 0, but I think in today's world, it's damn near impossible to get that low. But ideally, that's where you want to be at.
Right. By the way, I see a comment from Scooby Dooby Doo. Yeah. So the thing about dopamine, norepinephrine, those are what the newer medications are like targeting, right? Dopamine and norepinephrine. So yeah, you're right that those are two of the key neurotransmitters involved, especially in that prefrontal cortex, pathway for attention and concentration. So yes, I don't know. I'd have to read more, but I think he's mentioning like L-tyrosine and some of these things. I've heard anecdotal stuff. I'll have to look into the research, ask some of my colleagues about that. But the other thing too I wanted to mention before I forget too about the medications is you should definitely talk to the pediatrician, right, about side effects. We're talking about stimulants. I'm saying how efficacious it is, but there's side effects. If you have heart problems, right, definitely want to get that checked out first.
Potential for addiction with the shorter term,
yes,
acting.
There's potential for psychosis with any dopaminergic agent, right? So there's always that. So there's family history of psychosis. You want to. That's why you want to get a really careful history, because you can also exacerbate certain things like that. But that being said, yes, the cardiac ones, you want to screen the kids for any cardiac issues. Again, like I said, if a really skinny kid, then giving him a stimulant, they're not going to, it's going to cause weight issues, height issues. We talked about that too. There's been studies that show that yes, if you do years of stimulant use during the growth years, it's going to be stunted.
Yeah, and we talked about, it's not just the sugar and the fructose that's problematic in the brain. It's also the lack of fiber, because most people should be consuming 25 to 30 grams of fiber per day, and most people actually consume about 10 to 15 grams of fiber per day. Why is that so important? Well, it's basically the fiber is prebiotic, so it's going to affect your gut health, and that gut health, well, I should say the soluble fiber gets converted into butyric acid or butyrate, and that gets into your bloodstream and it travels to your brain, has anti-inflammatory effects. So it definitely, we talk about the gut-mind connection. Well, there's a lot of significance to eating fiber that it's going to impact your brain. So most people need to eat more fiber, and most people need to cut down on that sugar.
Right.
And also the third thing is most people need to get more omega-3s in their food.
Yeah.
And
See,
all of these things are incredibly important for your neurons. And it's no wonder that, you know, our brain function is less than ideal for most people. So that's why unprocessed food, you're naturally, when you eat unprocessed food, you're not eating the added sugar.
Yeah.
You're eating lots of fiber, and you're getting plenty of omega-3s. So that's the key right there.
Yeah, and I want to just respond to this comment, which is kind of funny, but yeah, I hear this a lot. Nicola says, she's saying she kind of agrees with some of the stuff and give them morals. Yeah, so that's what we were talking about, right? We're talking about, this is some of the stigma that's associated with ADD, which is the impulsive. They lack morals. The thing is, it's actually the flip side. The kids that have ADD are excessively punished. They're almost put in a punitive thing, like, hey, this is wrong with you, and okay, we're gonna spank the ADD out of you. That doesn't work.
Yeah.
Right? That doesn't work. It doesn't work at all. Restructuring
if anything, it actually just lowers their self-esteem.
It lowers their self-esteem. It actually adds to their depression, because it's not that they lack morals. Remember, that's not the, it's not like they're like, hey, I lack empathy. We write morals. I think you're talking about empathy, the ability to, feel what the other person is feeling and relate to that. That's a different thing. Now we're talking about.
I'm not sure she's talking about that specifically with ADHD or just morals in general with raising kids. But
well, because ADD kids they're the ones getting in trouble. They're the ones getting in trouble in the classroom. They're the adults that forget this and that, and get accused of being callous.
Right.
And that's a stigma, because then it's like, okay, you're a bad person. No, they're not. They suffer too, because it's not like they're doing it on purpose.
Right.
Right.
It's not intentional.
It's not intentional. I don't trust me when I forget my keys or forget someone's. It's not intentional at all, and I actually beat myself over. And not only that, but it adds more difficulty to my day, my daily schedule. I'm not able to get things done on time. Again, like, I've gotten better over the years, so I know how to make my schedule. But back in the day, it was distressing. It's not something fun that I want to live with, of course not. So I think just that part. Yes, are there people that also, have oppositional defiant disorder, conduct, kids that have that? That's whole nother separate thing. Comorbid, yes, there's a lot of comorbidities. Does it make it worse? Yeah. So it's really hard to tease some of that stuff out. So we're just talking about this ADD, right? Just pure ADD. But if they have oppositional defiant disorder, which is something against authority, like authority telling you what to do, that's not necessarily ADD. That's, I just don't like authority putting rules on me. Like, you have to sit down and do this, right? You have ADD when the kid themselves is like doing something they want to do but can't focus.
Right.
It's like, for sure, that's like bona fide. Okay, there's something going on there. So I just wanted to add that in there as well, because it's definitely like a complicated picture.
All right, so we have about 15 minutes left. If you guys have any questions, let's see. Wildwood TV says, "Get outside." Yeah, just getting outside. I mean, we're meant to be outside, and then what's been happening is we're all in buildings and offices facing computers, and we're meant to be outside with fresh air.
There's too many tasks, right? We're like having to multitask. Like almost compared to even 10 years ago, 20 years ago, multitasking a lot. Everyone's like on their phone, and they got this going on, they got their TV on. How many times do you see people watching TV and on their phone?
Yeah.
Right?
Yeah.
So they can't focus. That's people without ADD are finding it hard, because their attention is being consumed by so many things. I don't know if you guys saw, Social Dilemma. It's definitely worth watching on Netflix about, the algorithms to keep you hooked.
Right.
Fighting for your attention.
The artificial intelligence to design these algorithms to literally hack your brain attention, really.
Like Facebook notifications popping up. Your friend did this. Did you notice this? Someone doing that. Again, distracting you, wanting to keep your attention because it's been monetized, right? Keeping your attention has been monetized, and that's great. And guess what? Now there's a medication for that too.
Yeah.
It's a win-win situation, right? So I would say it really comes down to, from the get-go, childhood. But also, it's not too late to change if you're an adult either, by changing your lifestyle, diet, nutrition, and your day, and having like timeouts. Like, I'm time out from my phone, time out from this, time out from that. Sure, there's a spot for it. Sure, if it's emergencies, okay. If it's work-related emergencies, doctors, whatever, you need to have your phone. But really keep it to a minimum. That's I think most people's like.
And that's why meditation is also very important. So. Right. It's literally like you talk about dopamine deprivation. You're not stimulating your brain during that time of meditation.
Right.
It's not being constantly distracted. You're allowing your brain to just be at peace for a certain period of time. And also, being outside has that similar effect. And that's why actually a lot of people specifically will meditate out in the outdoors.
Right.
Yeah.
Lauren actually mentions in females it presents differently. you know, I don't know if that's a question or statement, but yeah, I mean, to some degree, again, the cardinal features are the same. It is attention focus, deficits. The impulsivity and the hyperactivity part, yeah, I think that they generally, like, the boys have a little bit more of that. That's kind of what they say, that the girls don't necessarily have that, although I've seen, some girls that have the hyperactivity part too.
Yeah.
But that's generally how it's kind of like, kind of seen that way. Again, I'm not a child psychiatrist expert, but that's something interesting to look into. I can definitely, towards the end of this, I'll give you guys some resources that you guys can go online and actually read about. There are some good resources out there. Someone also said about how do you diagnose ADHD. I know we're talking about, it is a clinical diagnosis, to be able to say I can diagnose someone with ADHD. There are screening tests that you do. There's a Vanderbilt, there's a Cornell, there's a few of them, but I think that most child psychiatrists do say that the Vanderbilt and the Cornell are good screening tests that they do.
Yeah.
So that is something that if you go on some of the websites that I'll tell you at the end, that you can actually, you know what, I can try to put out right now. I think I wrote them down. There's the ACAP, right? I think that's the child adolescent psychiatric. That's AACAP. That's a good website to go on. There's also one called Attitude, right? Attitude, but instead of the two T's and it's two D's, so Attitude. Those are some pretty good ones. CHADD, CHADD. You can Google that one too. Those are some good, reliable resources. Also on Harvard and Cornell and some of the universities that probably have some really good latest research and diagnostic and treatment options. But yeah, I would say, if you go to psychologists, psychiatrists, mental health, even nurse practitioners, mid-levels, they can do it. It's a clinical diagnosis. Pediatricians used to make this, right? And they still do. Nowadays, I think they're veering towards, hey, we're going to refer you to the child psychiatrist. But it's a clinical diagnosis at the end of the day, really.
Yeah.
And good history taking, ruling out all the other things. Then you can say, okay, this is probably what it is. And you see how they respond to the medications as well. You can see that. So if someone doesn't have ADD, what happens when they take stimulants, right? That's another question. That's the next question. Yeah, you know what?
So if someone does not have ADHD and they take these stimulant medications, will their productivity improve?
Yeah. right, it will. And that's why people want it. And therein lies the dilemma, right? Like, because we live in a society where productivity is so,
paramount.
The more deadlines you meet, the RVUs is paramount. And now we're that kind of society that, like, of course, to get any kind of advantage, you're going to want it. It's a performance enhancing drug in a way.
Yeah.
In that regard, but yes. The downside,
also too, when I'm at work, right, and when people have a break, like for example, if it's not busy at the hospital or something, what is everyone doing? They're on their phones, right? On social media, on Instagram, on TikTok. So it's no wonder that people are just having a hard time being productive.
Yeah.
While that pressure of being more productive is also there.
Yeah, and you also make to work, like, I don't know what the average person works here, like 50, 60 hours a week. In some of the other European countries, it's less. They realize that productivity is going to be, these many hours. After that, yeah, people are needing, I have quite a few people that are like working double shifts. They need Adderall just to be able to pay their bills.
Get by, yeah.
Right?
Yeah.
So, yeah, that's definitely like a huge issue. And I mean, again, giving medications, Adderall is not the answer. The answer is wholesale change, as society and what we value, as a society. So that's something that's like beyond our scope, but we can at least try to raise awareness. That's up to the politicians and people to kind of push that through. What else were they talking about here?
Let's talk about omega-3 fatty acids. Yeah, I mean the thing about omega-3s, or when you're eating unprocessed food diet, naturally your omega, the more processed food that you eat, the higher the ratio of your omega-6 to omega-3. And when you're eating purely processed food, it's about 20 to 1. Ideally, you want that to be as close to 1 to 1 as possible. And that's what happens when you're eating purely unprocessed food. And the reason why it's problematic is because you have these low levels of this chronic inflammation. And that's really at the heart of every cell in your body, in terms of including the neurons in your brain, where inflammation actually ruins the function of those neurons. So that's where the oxidative stress comes in. And that's impairing your neuron's ability to function at its best, including its impact on BDNF levels. And so when your BDNF levels aren't high, guess what? Your brain's not making these new neuronal connections. So everything is tied together, right? Yeah. So you can't just talk about one thing. Everything is tied together, and there's no question that lifestyle modifications are the most important thing to do in terms of overall health, but especially your brain health, and that includes ADHD. So once again, eating unprocessed food, which means getting enough fiber and reducing that sugar, exercise, getting good sleep, meditation, getting outdoors. You know, all these things that we know are good for us. They have to. It starts with, even before you're born. It starts before
honestly,
you're born.
we're talking about epigenetics, right? It's starting before you're born.
And then
even if you're not thinking about like having kids right this second, but you have to think about like the nutrition you're having, and also once you do say you're pregnant, women are pregnant with carrying a kid, you're gonna want to think about what you're exposing them to.
Yes, we know that fructose crosses the placenta. We know that fructose is in breast milk. So,
like I said, nicotine, right? Nicotine exposure, in utero, it's been shown to have issues with attention and concentration and focus. So these are things you want to really be careful what you're putting in your body, even before the pregnancy, even when you're yourself a kid. Like I said, the epigenetics is a real thing. The Dutch famine study that was post World War II, the famine started because of World War II and the blockade that the Nazis had. That was the longest, still ongoing study about the effects of nutrition, deprivation of nutrients, caloric restriction, and its effects on in utero exposure to all these things, and lifelong what happens. There's strong causal links to not just physical obesity and this type, all of that stuff, metabolic syndromes, but also mental issues such as depression, anxiety, ADHD, schizophrenia, right? All of these things all had a negative impact. So that's something to consider.
And I just want to say, because I see a lot of you commenting a lot, and I just want to thank all of you, including Nicola, Sue, Simply Anna. So everyone, thank you so much for being here. We are running out of time, so we're going to have to get going. But I do really appreciate you being here and comments, and thank you for being here, Dr. Hizbi Ali.
And
I think a lot of people appreciate what you're saying, and contributing to their education and my education as well. So everyone, thank you so much, and have a great rest of your Sunday, and take care.
Thank you guys. Bye. Thanks, man.